MRI is a unique modality or subspecialty in the radiology department. Its use as a diagnostic tool is well established. Excellent soft tissue contrast and the ability to scan nearly any part of the body aids in the diagnosis of both injuries and disease. From the toes to the lumbar spine to Homer's brain. MRI involves no X-ray or radiation. It utilizes the interaction of a very strong magnet and radio frequency waves with the body's hydrogen molecules to produce its images. MRI can reveal a non-hemorrhagic stroke, that is, one that does not involve bleeding into the brain, but rather is the result of the lack of blood flow by a clot, for instance, sooner than any other modality. Imaging of the spine often reveals herniated disc as the cause of pain, such as these pictures in the cervical spine or neck and the lower back, the lumbar spine. MRI reveals diseases of the abdomen, visualizing the liver, the kidneys, the pancreas, and gallbladder, for instance. And because of its lack of radiation, like ultrasound, in special circumstances may be used to evaluate the developing fetus. This is the examination area, where the magnet is housed inside a large gantry which dominates the room. As valued as MRI is in today's modern setting, it demands respect. Because of the massive pull of the magnetic component housed in the gantry of the machine, projectile injuries are a major concern. Complacency can lead to immediate injury or even death. We take safety very seriously, with warning rugs on the floor, warning signs on the doors, keypad door locks, and another lockable door between the operator's area and the gantry room itself. Despite years of existence and what should be an awareness of the danger, accidents have continued to occur about the world in MRI. Many dangerous items may be pulled into the magnet at 40 miles per hour. From the pen or pocket knife to these wheelchairs, floor buffers, and oxygen tanks. In December 2014, these two New Delhi, India hospital workers were pinned by an oxygen tank for 4 hours. One suffered a broken elbow, the other a fractured bladder and severe bleeding. Here I demonstrate the strength of the magnet by showing the pull it has on this hammer. Notice there is no examination taking place. The scanner is not running, but the magnet is always on. So, if you get a chance to visit the MRI suite as an observer or as a patient, please be safe. Listen closely to any instructions provided by the technologist. MRI is an interesting, even fascinating tool, but respect its dangers.